Our bloodborne pathogen precautions policy is located on Power DMS, listed as 4.08. It briefly reviews some of the items that we covered in this lecture, including definitions of AIDS, different types of bloodborne pathogens, different types of contamination, decontamination processes, what is considered an exposure incident, as well as who to reach out to in case of an exposure. I do not expect agents, ASACs or SACs to determine whether something is considered a true exposure. That is where our medical office will help support you and give you guidance on the next steps. We want to make sure that per our policy that we are anticipating any potential risks and making sure that we're practicing the proper precautions and workplace controls. So those risks are including handling of living or deceased persons, decontaminating equipment or vehicles, effecting an arrest or control of suspects, providing aid to others. It does touch on our universal precautions as well as any additional precautions that are needed, especially when handling contaminated needles or other sharp items. Making sure that we're using leak-proof containers during collection, processing, storage, transport, or shipping of potentially hazardous materials. It also outlines the PPE that you should be using. So here it lists latex gloves. Typically, we use nitrile gloves due to the risk for latex allergies, and also recognizes the use of an approved alcohol-based hand sanitizer. If someone has obvious contamination to their hands or another body part, you do want to use soap and water first, and then can follow it up with an alcohol-based hand sanitizer if needed. Vaccinations are available through the Department of Public Safety and our office. We do test all applicants for their hepatitis B immunity, as most people have received the hepatitis B vaccine series before going to college or during high school. If somebody is found to not be fully immune, we will offer the appropriate boosters and then follow that up with additional testing. As I mentioned earlier, sometimes agents will not be fully immune despite having multiple rounds of the vaccine series. And so we will provide counseling for future potential exposures as needed. If somebody does have a potential exposure, we want to, or if we're providing aid to someone else, we want to make sure that we are limiting our direct blood contact to any potential non-intact skin, our eyes, our mouth, our nose, or other areas where there are mucous membranes. When you're searching subjects, it's important to remember to wear gloves as much as possible. Obviously, during certain events, you may not have the time to really think about putting on your gloves, but when possible, try to keep a pair of gloves in your pocket and use gloves whenever you're anticipating putting somebody into control. Make sure that when you are searching someone that you, especially if they have any blood on them or other OPIMs, that you're using appropriate gloves before you do that search, trying to minimize reaching into spaces that you cannot see. For our decontamination, it outlines some of the equipment that should be cleaned properly, including flashlights, handcuffs, and other items. They should be cleaned immediately after exposure, and does outline the types of solutions that you can use for those. And then making sure that we're disposing of all of these contaminated items in the appropriate place so we don't potentially put somebody else at risk, especially if there's large amounts of blood in a vehicle. It does need to be taken to the highway patrol garage for formal decontamination. SAC responsibilities, the SACs are required to reach out to the physician on call, and that can be done either directly by calling the on-call number at 919-880-3203, or you can reach us through the Highway Patrol Comm Center. This should be done immediately, and that allows us to determine whether this is considered a true exposure or not. We will provide instructions then on immediate decontamination, and make sure that we have a process for obtaining consent from the source of that blood or OPIM if possible, and then also baseline testing and potential prophylaxis treatment against HIV for the agent that was exposed. We will then manage over the next 6 months a variety of lab draws, as well as counseling for that individual. If someone is not willing to be tested, the source is not willing to be tested, you can go through the magistrate's office to compel them to provide a blood sample for the purposes of testing for HIV or hepatitis B and hepatitis C. However, we need to make sure that those forms are filled out properly. We are working to update those forms as well, as they are missing certain information like the patient's written name and their date of birth. That's important for when we're trying to get records from the hospitals. If the source is not willing to be tested, or you're having any barriers to getting an order from the magistrate, we will proceed with a protocol for the individual, assuming it's an unknown source of the blood exposure. We need to make sure also that the employee, if they do choose to be tested and potentially treated, that they are signing the appropriate consents and release of medical information to our office. This will all be kept confidential. There is no requirement to go through testing or potential treatment, but we do strongly encourage it, as it's the best way to protect you and your family. Any further treatment will go through occupational health and workers' comp. So we will work with benefits to make sure that you have all of the funding and access to care that is needed after an exposure. And that concludes our review of the bloodborne pathogens precautions. Thank you so much for your attention.